of all, I will introduce the dragons who will come along and introduce themselves. And today we have three amazing suppliers. They are all apps, and they will all tell you about what their app does and the benefits that they actually provide. And then what will happen, we will make a decision following on from those pitches as to which one we think it has the most benefits. Okay, so very warm welcome to the first dragon. Hello, Janet. Would you like to introduce yourself?
Sorry about that. I'm Janet Smith, Head of Sustainability for Royal Wolverhampton NHS Trust and Walsall Healthcare NHS Trust. I'm looking forward to hearing the pitches and see what innovative apps we have available. Thank you.
Thank you. Karen. You want to introduce yourself?
You're on mute, Karen. There you go. Sorry, I didn't hear who you were asking to introduce yourself, which is a really good start, isn't it? Hi, Karen Taylor. I lead a small research team in Deloitte called the Centre for Health Solutions. I'm also a non-exec on Kent Community NHS Trust, there are a lot of apps around, so I'm really interested to hear the pitches for these apps. I do think digital is really important for improving access for people and to supporting people's own health and well-being. So I'm just very excited to see what you've got on offer today.
Super, thank you, Karen. Tosin, would you like to go next?
Hello, everyone. Once again, my name is Oluwatosinloba Adewunmi. So People Services Administrator with NHS England. And I'm glad to be here because I'm starting a PhD program and in the health sector. So I'm really excited and happy to be here to listen to the pitchers, to hear what they have to say in terms of the health sector, because I'm very, very passionate about the health sector. So I'm glad to be here. Thank you.
Thank you, Tosin. And last but not least, Mervyn, would you like to introduce yourself?
Thanks, Ian. My name's Mervyn Eastman. I'm a member of the unretired. I retired as a Director of Social Services some years ago, then led a government quango related to older adults and policies, and then latterly got engaged with broadcasting and radio. I'm a podcaster, occasional radio host, and I help form the Later Life Audio and Radio Cooperative. But primarily, I'm an agitator, a disruptor, and a basic pain when it comes to looking at issues around later life.
Thank you so much to all of you for taking part in this great event. And I too am super interested in the technology area. So I'm very excited to hear all of the pitches that are going to be taking part today. So we are going to introduce our first pitch.
I'm ready to go.
Okay, I'm going to start the timer now.
Thank you very much. So I'm Brian Fisher. I'm one of the unretired as well. I'm a retired GP, and I work with two other doctors in Optimise BP. We're talking about high blood pressure, and I can see most of you are medical, but not all. So I'll be very brief. Hypertension takes a lot of time in general practice, usually managed in primary care. It's a significant part of GP workload, 12%. It often involves lots of repeated face-to-face or telephone appointments. It's an NHS priority, costing the NHS a lot of money every year. But despite all of this time, in fact, the management of high blood pressure is not good enough. It's very common, it's very dangerous, and you don't know you've got it. It's a very serious issue and needs to be treatment needs to be improved. There are 4 million adults who are walking around with high blood pressure and don't know it. And if you are treated, 30% of those treated are not treated target. And we also know that even a small improvement in care would lead to a dramatic reduction in cardiovascular events, which is why we have Optimise BP, which automates the management of people's blood pressure. It provides safe, cost-effective, automated blood pressure management, and it also helps with screening. It integrates with the two big GP providers called EMIS and TPP, and our audits show a 40% time saving. So that's 40% time saving of the 12% of total workload. And we have two main functions. We help manage individual people with high blood pressure by automation, and we also help the practice screen for these 4 million people. So if we focus first of all on the automated management, a GP will see a patient, choose the medication that they want, and they will set the steps of increasing the medication over time, and then they will ask the patient to download Optimise BP, and then Optimise starts talking to the patient. It reminds them when to take their blood pressure. It reminds them when to have blood tests if necessary. It asks them whether they're getting side effects. And if all is going well, if people don't have side effects and things are safe and continuing, but the blood pressure is not controlled, Optimise BP will then ask the patient to increase their dose. And to our knowledge, there is no other app that does this in the world. So the idea, as you can see, is to avoid, to substitute for those repeated face-to-face appointments. This is what the app looks like from the patient's point of view. It's very straightforward, gives them much more information than they would normally have. It tracks their blood pressure, but really the only thing people can do with it is actually to record their blood pressure, which then the GP can see, and they can add to their GP record. These are the examples of the messages that patients receive. Very straightforward, very simple, very clear. And also we have a clever trick to help practices screen for those 4 million people who are not found.
Seconds.
Oh my goodness. And we help them do this very easily and quickly. Patients are very happy with the app. It's very clear and helps them to improve their control. We integrate very well with the NHS and have lots of certifications. And the benefits are really very clear. Saves time, engages patients, and it improves monitoring. So it's a big advance, saves GPs time, saves patients time, and is very helpful. Thank you very much.
Nearly perfect timing. Now, shall we go to our dragons? Who would like to ask the question to Brian first?
Janet.
Hi, Brian. Very good presentation, and I think the app has a lot of potential. I just wanted to ask, how far are you in terms of actually implementing this app, and which NHS Trust or GPs have you already worked, and what's the response?
Yes, well, yes, it's available. We're talking to lots and lots of GPs about it at the moment, and I remain quite interested to know. We haven't had the conversations with trusts yet, but I do think there is an opportunity for trusts to use this. I've spoken to a couple of consultants who say, we treat people with hypertension, and then when we discharge them back to general practice, we kind of lose track. So this would be very helpful to help keep track. So I think that maybe cardiologists or nephrologists, kidney specialists who would find that useful. So yes, we're in touch with a lot of GPs. We have, it's now in 7 or 8 practices at the moment, and we're doing demos, a couple of times a week to practices. And they find it easy to install, easy to use. It's very straightforward.
Super. Thank you. Karen, do you want to go next?
Yes, and thank you, Brian, for the presentation. A couple of questions. I saw, because you were being pushed for time, that you had a reference to MHRA. Could you just explain what you had to do to get the approval from the MHRA?
Yeah, for a class 1 device, it's a self-assessment. So you have to put in quite a detailed description of the app, what it does, the evidence for it, and the safeguards around it, and the way in which it was developed using clinical safety processes. And then we've received an acceptance. So to my knowledge, I don't think MHRA actually has necessarily in detail looked at the application, but they are entitled at any time to contact us and to get us to prove that what we're saying is true.
Thank you. And could I just clarify on the titration changes that
Yes.
you discussed? The communication with patients, both about the need to change their medication and how and does that still involve a visit to the GP to do that, or is it done automatically through updating their prescription? And is there an opportunity for patients to feed back other than just their blood pressure to the GP through the app?
So in terms of the titration, no, they don't have to go back to the GP. That's part of the point, that it advises them to increase the titration. So what's sensible from the GP's point of view when they're setting people up is to provide enough medication so that they can increase the dose in advance if necessary, and also to provide them with blood test forms, which they do. So then the GP really has effectively set everything up so that the app can continue to do its work without face-to-face appointments. And what was the other question? Sorry.
Whether there was an opportunity for the
feedback.
Patients
Yep.
to feedback.
No, we've kept it as simple as possible. I can assure you that patients contact their GPs all the time with feedback, so they can use all traditional methods to do that still.
Okay, thank you very much.
Mervyn or Tosin? Tosin, do you want to go next?
Ryan, I want to say thank you very much. It was a wonderful presentation. Well done. So my question is, you talked about screening. So does it mean that people who have not been diagnosed with, high blood pressure, with hypertension, do they need to use it? Or is it just when you have been informed by your GP, or when you feel somehow, then you think, oh, let me download this app and let me see if I've got hypertension or not?
Okay, no, so the way it works, and I didn't have much time to explain it, is that GPs are encouraged and I think funded from NHS England to look for people who may have high blood pressure. As I say, it's asymptomatic, so you don't know that you've got it. So there are lots of opportunities to take blood pressure, but for instance, the arrangement would be that a practice using its current systems, not using Optimise BP, would reach out, say, to all people over 50 who haven't had a blood pressure taken in the last year, say. And the system that they have would enable them to identify those people. And they would send out a message to those people with a link to Optimise BP. And then people would download the app, start recording their blood pressure. And our experience is that you get about a 20% response rate. And then once those blood pressures come back into Optimise BP, the practice can see them all. And then what's clever about Optimise is that it separates out the normal blood pressures from the high blood pressures. The practice can at one click, file and record all those normal blood pressures and focus on the people with high blood pressure. We don't think other apps do that either, but we're not quite sure. But it's just a neat little trick that saves GPs time. So it's still a GP focused process. It's still something that starts with the GP, reaches out to those patients, but Optimise BP helps the patients record their blood pressure and for the practice to manage that cohort of people.
Okay, so one last question, please. So in terms of data protection, what is the arrangement in place on the app?
Data protection, did you say? Yeah, so
Yes.
it's we can't do this without full data protection from the NHS. That's one of the areas that is required to get assurance to be able to use this in the NHS, and the same applies to these GPIT providers. So they also are very strict about IT security and cyber security, and every year we have to complete what's called Cyber Essentials, which is about data protection and data security. So we have to reassure the NHS on a regular basis that we're keeping up to date and that we're, keeping data secure and using all correct procedures.
That'll be all from me. Thank you, Brian.
Thank you.
Thank you. Mervyn, have you got any questions? You're on mute. Sorry, Mervyn.
Yeah, sorry about that, Sue, and sorry particularly Brian. Brian, thanks for that. I wish I could condense into 4 minutes things that I wanted to say. I'm going to take 4 hours. And I also want to make clear that I'm not a clinician, so some of my questions might relate simply to that. Okay, the first thing is you talked about very much the over 50s. So is there yet some idea from those GPs using the app, and what percentage of patients are actually in their later years? So the demographic of the patient, is it younger or primarily older adults?
I mean, young people can get hypertension, but it's pretty unusual. So it's really, there's also something called the NHS check, and that's really done for people over 45. So most of these things are over 45s. I was using the 50s just as an example of what, but it's true. It's that's where the predominant prevalence is. Yeah.
In terms of promoting this to GPs, because it's basically a tool for GPs to manage, can I come to it from the patient's point of view, and how far is the GP sort of advising the patient to download the app or use the app, and how does a GP deal with those patients, of which I'll probably one, that I might well download an app, but I can't be asked to use it. So in that sense, how does the product actually encourage and help people to actually use the app rather than just have it?
Sure. Well, our experience is that they do use the app. If the GP recommends it, they certainly try it, and it's so simple that it's difficult not to use it well. But there will be people who can't be asked and who therefore don't, for instance, record their blood pressure at all, and don't tell us whether they've got side effects or not. They're just not responding. And in that situation, we have a safety mechanism in place. So we keep reminding them, relentlessly reminding them, and if they continue not to respond, then we switch them off. Basically, we put them into what's called basic mode. They're told you can't use the app anymore. You have to contact your practice. The practice is told that they're in basic mode, and they have a dashboard which shows all the patients in basic mode, for instance, and various other data that they can collect, that they can see. So yeah, that's how it works. And if you don't want to use it, and of course don't use it, go back to the normal. We're not imposing this on anybody. It's only for people that want to use it, and there's the usual GP services available still. And
what about upscaling? getting more GPs to be signed up to the app. What's your strategy in relation to that?
Yeah, it's very hard graft, I can assure you. So it's very difficult to engage GPs. We have lots of interest, actually. We go to conferences, we put ourselves out on LinkedIn. So when GPs hear about it, they immediately see the benefit. It takes about 10 seconds for them to see how it might be useful. But actually converting that interest into a demo, into the practice, and then them starting it all up, it's hard work. So that's partly why we're keen to talk to groups of practices, primary care networks, and also ICSs, which is the bigger picture too. And we're doing that, but I have to say it is hard work. GPs, the reason for this app is that GPs are under fantastic pressure, huge time pressure, and that actually means that it's quite difficult for them to spend the small amount of time that's required to understand this app and to put it into practice, because they're running so hard they haven't even got the time to find something that would save them time.
And that's always going to be a pressure, isn't it? No matter what. In the interest of time, because I know we've got 2 other pictures to go on, if you do have any further questions for Brian, please do pop them in the chat to him, and I'm sure he'd be very happy to answer them. But thank you so much, Brian. That was absolutely brilliant. Thank you to the Dragons again, but we are going to move on. We'll start timing now. Over to you, Daniel.
Brilliant, thank you very much. So yeah, my name's Dan Cordwell. I'm the head of partnerships at Hapstar, and I'm one of the founding members of our team. And yeah, it's a pleasure to be able to take just a few minutes to talk to you today and introduce you to a little bit about what we're trying to achieve at Hapstar. So Hapstar is a specialist mental health and wellbeing technology company, and our main focus is to supporting individuals and employees and staff within an organisation to proactively manage their mental health and wellbeing, and then at the same time we want to provide our partner organisations with a really clear, rich data picture on how their people genuinely feel about their health and well-being and their career. So they're kind of the 2 key components to Hapstar, but that first part is the most important, and that's about empowering the individual and giving the individual the knowledge and confidence to understand the challenges that they have in their life when it comes to their health and well-being, and then connecting them with the right resources and support to make a positive impact on them. And we do that by getting the individual to engage with our advanced health assessments that allows them to identify the root causes of challenges, and they assess themselves against kind of the 5 core pillars of their well-being, so how they feel about their mental health, how they feel about their physical well-being, their career and social well-being, or their friends and family, and all that kind of outside of work part, and then their financial health as well. And we track that over time, and we help the individual to build a well-being profile. Then based on how they've scored and how they actually feel, we then connect them with the appropriate support, and that support could be building them a personalised action plan of tools and resources and content based on the topics and facets of wellbeing that they're interested in. It could be as simple as signposting them to just a quick e-learning video delivered by an expert based on the topics that they need help with, or it could even be booking them a session with one of our qualified professionals, so one-to-one support with a qualified therapist or coach to help them unpick their challenges and give them that kind of personalised one-on-one support. Now, the most important part of our platform is our early warning system, and this sits behind the scenes and is essentially just on the lookout for anyone showing the signs of deteriorating mental health. And when that happens, we then triage that person to the right support so they get in the moment help if they're on the cusp of kind of a mental health crisis. And if we help just a handful of people to do that each week or each month, obviously it's a massive win for us and some real impact and that we've made. Now, if we do that first part effectively and we collect lots and we engage a really consistent and high proportion of our partners' employees, we start to build a really clear data picture on how that organisation's people feel, and we can segment that data by different demographics, and we can help them identify trends and spot red flags, as well as really give their people a voice to feedback on how they actually feel about the organisation that they work for, and use all that data to try and create a psychologically safe working environment. So we're a relatively young organisation. We work with a real diverse range of clients, but we do work with some NHS Trusts. We obviously support IHSCM's members, and we've just partnered with one of the larger care providers, social care providers in New South Wales, actually, which is a really exciting project. But I'll spend the last 30 seconds or so just talking a little bit about our project with the East of England Ambulance Service. So there we're supporting 6,000 of their members of their staff. Obviously, predominantly a lot of them frontline paramedics. And yeah, I don't know to go into the detail of the high pressure.
30 seconds.
Thank you very much. The high pressure and kind of stressful situation that it is being a paramedic, right? It's demanding and challenging conditions. And if we can help just one or two of their employees who are showing the signs of deteriorating mental health, who've come off a challenging shift, it's the middle of the night, they don't know where to turn for help, and we get them the right support, that's a big win. But the bigger picture is to engage a really diverse and representative sample of East's workforce, so we can give them the data to make informed decisions for how to better support their people. So that's it. That was a whistle-stop run through. But yeah, we're a small team. We're really passionate and would love to explore this more.
So let's bring in the dragons again. Janet, you are there with your hand up. Do you want to go first?
Yes, thank you, Daniel. It's really, really great presentation. But as usual, there's questions. One, I got two questions. One is the cost. What's the cost actually of the service? If, let's say, a trust actually wants to implement it, wants to adopt it, what's the cost involved? Second is for those, let's say, staff that actually require support and it's indicated in the app, how does the app actually automatically, contacts the local mental health team, or is there an arrangement with existing teams to actually respond to it?
Yeah. Okay. Yeah. So if I tackle the second question first, so a really important part of the platform is that it's customizable, because we really don't want well-being and mental health, workplace well-being in particular, to be a one-size-fits-all approach. You probably saw on that screen that I flashed up for 2 seconds that we work with everything from recruitment companies to NHS Trusts to working on employability contracts, supporting people that back into work, and they all need a slightly different touch and an approach, right? So being able to build it out so it's representative and going to support that demographic is important. So, for example, some of our clients take a fairly off-the-shelf version of the platform and embed that into what they do. But particularly in this sector, and with the East of England Ambulance Service as an example, they have a wellbeing team and a bank of really great resources. So by going through our assessments, we're also triaging people into all that support that's already in place. So that could be their own therapists and counsellors, or it could be connecting with their wellbeing team, or like trim practitioners as an example as well. So hopefully we drive engagement to all the things that are already in place to support their people. On the cost, there's a few different factors which are not worth running through today, obviously, but it's kind of the technical integration side and some of the customization elements. But we charge an annual fee for the project, right? So we don't charge per member of staff, because we have to work very hard to engage people, and we don't want to punish good usage of the platform, right? We want the platform to be available for everyone. So the more people that we get through the front door and getting benefit from the platform is a bonus, and we don't want to mean the price goes up. So yeah, it can start at sort of a few £1,000s per annum upwards, kind of based on the package and size of the organisation.
Okay, thank you. Karen.
Yes, thank you, Daniel. I was going to ask about the cost, but I'm going to part that. In terms of two things, in terms of validated approval, the similar question that I asked on whether you have got regulatory approval for this app and a platform. With good platform and the apps that you get used to engage with, and the second one is what are the types of data that you collect that give you the signals that someone may be in distress and you need to intervene, and who triggers that intervention, the individual or your team monitoring the responses?
Yeah, really good question. So on the triggering of the early warning system, that's done at various points throughout the platform, but initially the individual comes in and they take a check-in, so an assessment where they score how they feel about different facets of their mental health and well-being, and it's low scores that can trigger that early warning system. So our clients have control over the thresholds, because obviously some of our clients' demographics are more at risk to poor mental health. So there's flexibility there, but what's really important is the platform is completely anonymous. So your employer or your HR team or if you have a wellbeing team are never going to know an individual scores unless that individual chooses to share their identity. Because if you're going to come in and score on quite personal things like your relationship with your family and your sleep and rest and your health, then it's really important that you feel confident and safe in the environment to do that. So it's completely anonymous. Not even Hapstar and our team can see individual people's scores. So it's the tech that's triggering, and AI essentially, that spots those signs, and then it's all automated behind the scenes. The individual then can either get anonymous help, or they could say, okay, I want to reach out to my head of wellbeing at my trust and get support, and I can choose to reveal my identity. On the regulatory approval, so we align to the NHS pillars of wellbeing, 5 pillars of wellbeing methodology. The platform doesn't have approval, but the professionals that sit behind the platform do, right? So all of our therapists and coaches have at least 2 years experience and PhDs and doctrines in their fields. So that's really important, that all of the advice and guidance that we give in the platform comes from qualified professionals, right? And so whether it's a doctor if it's talking about musculoskeletal challenges or heart health, or a psychologist if it's talking about coping with anxiety, or even a financial expert, right, if we're talking about helping someone to budget effectively. And that's really important. That underpins everything that we do.
Thank you. And just one final question, which is, there are a lot of mental health app support out there. How did you differentiate yourself?
There are indeed a lot of mental health apps out there. It's an incredibly busy market, and there are lots of other fantastic tools out there as well. So that's really important. I mean, our main angle that we want to approach this from, we're not necessarily being clinical and helping someone diagnose that they've got anxiety or depression, but we're about helping people proactively think about the real challenges that they've got in their life, right? And that could be that they struggle to get a good night's sleep, or it could be that they're dealing with a difficult relationship, or it could be that they're not managing their health correctly, and then we connect them with the right support based off of that. But what we do is we have to work incredibly hard to make sure enough people from each of our clients' workforce use Hapstar, so then we can tell the really interesting picture with that data, right? We can say how staff at different locations feel, or different job roles, or gender or age groups, and really give them that clear picture so they can understand kind of a holistic look at the well-being of their people. So yeah, but we have to work very hard to make sure enough people use Hapstar in the first place so we can achieve that.
Rosin, did you want to come in?
Yes, I was just going to say, Karen took the question out of my mouth because I had it written down here, but I'll still ask it because I've got 2 questions as one. So what makes your platform different and appealing to people? Because I understand, I work in the back office as HR, and I know people shy away from mental health issues based on trust and all that. It's confidential to a lot of people. So what makes your platform different and appealing? I know there are a lot of groups and platforms, like she rightly said, encouraging proactivity as it relates to health and well-being. Why do you think, or why should people rather subscribe to yours?
Yeah, a lot of it comes on the customization piece. So we're not a B2C app, right? We always partner with an organization such as IHSCM or these things, an ambulance service, or LexisNexis, Brisk Solutions. But building it so it looks and feels like it was made for a paramedic or an engineer or a recruitment consultant is really important. So the East of England Ambulance Service call it the Time for Me platform, and it's powered by Hapstar, but it's white labelled and branded for them, and they configured it to tackle the challenges that paramedics face. We try really hard to not be a kind of vanilla approach to wellbeing, right, and fluffy, I suppose, but really addressing the real challenges and focusing on the topics that demographic needs support with. So that's really important. And then the other side is, as much as a partnership with Hapstar is the tech and all the information security and all those important aspects, it's also our team working very, very hard for each client to make sure that it's promoted correctly and that we train people on how to use it and we educate people on the anonymous aspect and the benefits. And there's no silver bullet answer for that, because every client's different and they have different people and their organizational structure is different. But it just has to be us being innovative and clever and really never stop trying, right, to figure out new ways to keep it interesting and exciting and make sure that there's that kind of repeat usage as well. So it's kind of that service layer, I suppose, which lots of us apps and platforms perhaps don't offer.
Can I ask another question, Sue?
It's okay. I mean, I know I'm conscious that Mervyn might need to ask a question, but carry on, Susan. I think we've got plenty of time.
Just one question, please. So, Daniel, you mentioned that based on the feedback from the app users, you can signpost them to right resources and support that they need.
Yes.
So what is the yardstick for assessing and determining the appropriate support that these people need?
So what is the, sorry, what?
What is the yardstick, as in what determines the kind of support that they get based on their usage of the app?
So it depends on the severity of their challenges, right? So people, what's really important is if someone shows the signs that they're at crisis point, it's not really appropriate to go recommend them a punchy e-learning video on building more resilience, right? It's about stopping everything and getting them the right help they need in that moment. So it's all determined on their wellbeing profile that they build by taking our assessments, and then depending on where they are on certain thresholds, the support changes. So sometimes, if what's really important as well, we don't want Hapstar just to be that tool for kind of in the moment support. There are EAPs and crisis lines and things that can do that job as well. It's also a tool for everyone, right? You can have good, bad or indifferent kind of mental health, but it's a tool to kind of keep good momentum and build positive habits and continue to develop as well. So it all comes down to how you score on those initial assessments, and the platform reacts based on that to what the most appropriate content would be.
Thank you, Daniel. That'll be all from me. Well
done.
Thank
you.
Lovely. Thanks, Tosin. Mervyn, did you have some questions?
Yeah, thanks. And thanks, Daniel. What is the interface or the intersection and threshold where you're picking up from a particular organisation a profile around the well-being that seems to be very disturbing? And what's therefore the intersection with safeguarding and the safeguarding policies of the organisation, and how is that managed, and what happens?
It's such a crucial question, because you're right. Obviously, it's rare, but there are times where people that are going through the Hapstar process are at crisis point, right, and perhaps share information that they are in a really difficult situation. And what we have to be very, very careful of is getting the balance right between respecting the individual's privacy and their right to anonymity. That's hard to say, I thought, but then also getting them the right support by duty of care, right? So as part of our terms and conditions and our user terms, and kind of in accordance with GDPR compliance, there are safeguarding factors. So if someone says something that they're gonna hurt themselves or hurt somebody else, for example, that we can identify that individual and make sure we take the right steps to get them the appropriate support, and can also notify their employer as well. And obviously that's hopefully a very small case sample, but obviously with the nature of what we're doing, we're going to have people that have varying levels of challenges, right? So it's important that those safeguarding policies are in place, and that also our clients are aware of what the process is when that crops up. But we have things like sentiment detection and things that are automatically spotting those red flags and then notifying us and the employer.
Thanks for that. Is the app sensitive to not just changes, but where, for example, we know that organisational cultures, often coming from the top, are actually creating an environment which is very harmful to the employee. And if you're getting a trend from your data, that a particular organisation seems to be having a challenge with the numbers of staff who openly will be saying that they either feel frightened, threatened, abused. How do you deal with that?
So as well as the front end of the platform, which is kind of what we've spoken today about, which is the employer version, our partners have access. So whether it's a HR team or a wellbeing team or even senior leadership in some cases, they have access to kind of the back end of our platform where they get reports where they can see how all different demographics within the organisation are scoring. So again, we never show individual scores, but you might want to look up frontline staff, or you might want to look up office locations, or you might want to see how males and females compare, for example. So that's a really important part of what we're trying to do, right? As well as being that kind of front end support for helping the individual, we want to be able to help our partner organisations make informed decisions off the back of that data, how to better support their people, right? So they can see a particular team are scoring low and on workload or stress levels or motivation or whatever it might be, so they can react to that data. So we want to work with our partners, right, and be very open and honest with them to share that data and help them to take action off the back of that. So it's really important that when we do partner with an organisation, that their leadership are open to listening to the data, right, and taking action off the back of it, because we're going to provide sort of hard evidence on how people are genuinely feeling about their mental health and the organisation that they work for.
Supposing I'm a chief exec and I've got a small workforce, no reflection on the institute at all here, but how do you hold to account an organisation that is not transparent, that is getting the information that you're providing, it's anonymous, but there's clearly trends there that cause some unease? How and what impact do you have in terms of your responsibilities to ensure that it's a two-way process? Does that make sense?
It does make sense, and it's a challenge sometimes. People have to be willing to work with us and listen to the data, but a lot of the time that's part of the reason they partnered with us, was to get access to and get that kind of understanding on the workforce. But what we do is we benchmark our organisations, so you can see how you compare against other similar organisations and see, okay, where are we scoring lower against organisations that are similar to us? And that's quite a good way to get people to take action, right? Because no one likes to be low down on a league table. So sort of giving that holistic view and comparing is a good motivator sometimes.
That's brilliant.
Thank you, Daniel.
Brilliant. Thank you.
Thank you so much, Daniel. That was absolutely brilliant, and I think you answered the questions really well there. Some tough ones particularly, but good, constructive ones too. So thank you, Daniel. Right, definitely last but not least. Okay, so do you want to start now?
Great, thank you. Super. Hello, everyone. I'm Shain Khoja. I'm a physiotherapist and founder of Thriving.ai, which is a digital application that helps with remote monitoring, care coordination, and communication, and uses AI and machine learning to provide deeper insights into the care situation. We are all aging. At the moment, the UK population is 20% over the age of 65, which takes the lion's share of the NHS spending budget. But although we're living longer, we're not necessarily living healthier. 60% of the population has 2 or 3 chronic diseases. And because our care is fragmented, siloed, and reactive, people fall through the cracks. There are unnecessary complications and emergency calls out, hospitalizations, which increases staff burnout. This model of care is not sustainable in the long run with the aging population rising, and what we need is an integrated model of preventative care in place. Our solution is an integrated custom platform bringing who and what you need together in one place. And this platform grows with you and your needs. So on the platform, we have the ability to monitor your mental health, your daily vitals. We can coordinate care, communicate using one-to-one, one-to-many communication tools within the app. There are embedded health and wellness tools, socialization tools, and a companion chatbot that can help to triage poor mood and mental states. And what is most important is that we also collect data, and 3/4 of the world doesn't have data for an aging population and an older population. And this data is provided on a back-end dashboard and can be analyzed in different ways. Every organization has access to their dashboard. All the data is anonymized. It's GDPR compliant, HIPAA compliant, has passed ORCA certification and NHS cybersecurity. And alerts can be customized to help detect deterioration in well-being or any other parameter. In our pilot with the Northern Ireland Health and Social Care Trust, we had individuals aged 79 to 95 years old who had never used a technology tool. 90% of those individuals could use the tool. They experienced a positive response to it, could navigate it, and in fact hacked it so that they allowed more people into their circle of care. Family, 50% reported better connection, and we saved 20 to 30 minutes in care coordination and administrative work for care workers. We continue to work with providers to customize the data to their needs. In our most recent pilot with dementia patients, enabling them to live in the community for longer, we worked with a clinical psychologist and a preeminent individual in dementia care. We integrated a wearable and used our smart plugs, bulbs, and movement sensors, and devised a pattern of activities. In all the patients, we were able to spot the beginning of agitation and reduce episodes of distress. And in one patient, we were able to show that the psychotic medication that was prescribed PRN was actually not helpful, and they were able to be taken off that medication, which improves quality of life, reduces distress, and takes away risk factors, which can be as serious as stroke and death. We are seeking to work with forward-thinking health and social care champions. We want to help to provide better managed human and financial resources, secure better care packages that actually help monitor, coordinate, and deliver care. Maybe not as many visits, but as many visits reinforced with online visits so that people feel confident and comfortable. We also want to reduce the stress on family, caregivers, and healthcare professionals that work in the community. And of course, more than anything, enable older people to age safely, independently, and inclusively in the community, which is a more cost-effective model of care than the acute or institutionalized model of care. If you are interested in talking to us, we would be very keen to work with you. Please reach out to me, Shain at Thriving.ai. Thank you for listening. I'm done.
Absolutely spot on. Super. Karen, you've got your hand up. Would you like to go first?
I thought I'd take the pressure off Janet going first. Could you say a little bit more about the ORCA approval, or whatever they call it, certificate. Sorry.
So Orca is quite a detailed certification. They go through your user interface, your user experience, all the different functionalities, and they rate them. And it's a score out of 100%. We scored 79%, and have sort of improved that score over time. Basically, they also give you recommendations on what you can do. In order to sort of deploy the solution in Canada, we also had to go through Canada Health evaluation, which they did. And that is a very deep evaluation, because they also look at how you host your data and how secure it is when it's in transmission. So we use an AWS hosted managed service to do this. All the data is encrypted and cut into bits so that nobody can actually put the bits together and identify anyone.
Thank you. And just a follow-up question. You talked about the engagement of people from the ages, and I wrote it down, but I can't read my own writing, but from 75 to 90 something. How do they engage if they are not digital literate? What is the sort of human in the loop angle of your AI enabled platform?
So a few things. The platform was designed with older people in mind, and I will be the first to admit that our first design, 14 out of 14 people kicked it out because they said, we're not stupid, we're not dumb, we're just less dexterous. So it was designed with them. I think that basically the system is very simple. Their check-in for their mood is red, amber, green, right? If they score a red, then immediately Vicky, our chatbot, will start asking questions about why they're feeling that way, and will also guide them to different areas in the app. We don't, as such, assess them. This information goes to the administrator or the principal family caregiver, and then they take that action. So our customer is the B2B customer, or in the instance when it's downloaded off the App Store, then it's the principal caregiver. So basically what we are doing is giving, reinforcing statements. Everyone has a bad day. Perhaps you can try doing a learning journey. Fantastic that you're having a great day. Spread your cheer to 3 other people in your circle, and so forth. But on the back end, that data comes in, and for the organizations that contract with us, they can actually look at that data and say to us, we want these check-ins prioritized so that we deal with them first and then the other, and so forth. And so we have an app interface for the care recipient, who's called the Thriver. We have an interface for the caregiver or the professional, so they can see the data on the move on their smartphone or tablet. And then we have the back-end dashboard for the organization that can see it across the entire organization.
Super.
Thank you.
Thanks, Karen.
Mervyn, you had your physical hand up.
No, sorry. I love Karen's point. Where's the human in the loop? I'm going to remember that and quote it.
Yes.
Of the 3 presentations, this one, Shain, causes me the most anxiety.
Okay.
And I'm not sure why.
Okay.
One is that you talked about your demographic were older adults. Does the AI or does the app make assumptions about age and aging? Does it make assumptions, for example, about loneliness and so on and so forth? And I'm not sure about that. Secondly, the caregiver, if you're looking at the extreme end of care, has got a lot to worry about and a lot on their shoulders. Not just responsibilities for caring, but may well be with their partner or their own children, adult children, or so. It's about how simple this is and how effective they think it is using this particular app. And I'm also slightly anxious. A question's coming here somewhere, so forgive me. But a question or an issue I've got is AI is relatively new, and it creates a lot of issues. And only yesterday I used AI to define, because I wanted to see what it was going to say to me, to define what's the meaning of a green old age. And it came back to me saying it's older people who are sensitive to climate change, environment, and so on and so forth. And so how far is the app flexible enough and sensitive enough to be able to look at the nuances around the very issues that you're trying to measure?
Excellent questions, Mervyn. It's what keeps me up at night. So let's just talk about the AI. The AI, initially, we have guardrails, right? So we have 10 flows that the AI can do, right? And those are related around mood. So let's just take a mood. Say you check in red, right? If you check in red, it will take you through a mood umbrella to ask you a few questions about why you're feeling that way. It may then suggest that we take your heart rate, blood pressure, etc. We have a camera technology within the app that they can scan their face for 60 seconds and it will give them readings. And then depending on those readings, the AI might say that, oh, your health and wellness score today is 8 out of 10. That is quite good for you. Would you like to speak to a member of your circle? So it's very safe pathways at the moment. What we have been exploring are open pathways to OpenAI, and exactly the example that you gave when somebody asks, what is an apple? The AI doesn't know if it's talking about an Apple device or an Apple fruit, right? And so we have very limited flows open, and we want to work with organizations and the patient groups that they work with to ensure that those pathways are correct, because obviously we don't want any negative information to come across. In terms of the caregiver, the family caregiver, this app was designed especially for that, because someone like me who's managing my career, my 89-year-old mother, speaking engagements, my kids, it's crazy. 1 in 3 of us fall out of the workforce, right? And we're just pushing the problem further down the road. And often we are unwell ourselves. So the whole idea of this was to have the care on the go, that you can be part of the care coordination, get your notifications, know that mum is fine. If mum checks in red while I'm on this call, I know that the first thing I have to do is call her. And that's as simple as, I couldn't show it on the slides for the time, but it's easy for people to use because my mum's face is right there. I just tap it. My face is right there. I just tap it and I get in. And I think that the sort of pathways that we're following are from self-reported engagement with the app. So it's not like we're taking a data bank of synthetic data and just applying it, right? What we do is we research on synthetic data and then we look at our actual data, because you'll appreciate that there are data sharing issues around research and we need special privileges to actually look at real data to analyze. But we're working with the Turing Institute and the Vector Institute in Toronto. These are specialists in this area to help us develop and evolve this. I hope that answers your question.
That's amazing.
Thank you very much.
Thank you. Either Janet or Tosin, do you want to come in?
Hi, Shain. Lovely
Hi.
presentation. Well done. I have just 2 questions, if you don't mind.
Please.
So, since the app is remote monitoring, what if there is a phone or a period of phone malfunction? Something happens to your phone. What happens?
So basically, we get the data 2 ways, right? We get the data directly into our back end. So that would trigger to the organization an alert. For the caregiver, they would get an alert from the platform, from the cloud into their phone, because the sort of pinging data, like older adults told us they don't want cameras, right? So that's why we use these non-intrusive devices, right? So basically there's activity in the bedroom, and then there's activity with the door to the washroom opening, and then it closes, and then they go off and they put the kettle on, and that's how we follow the daily pattern. If there's any change in that pattern, those messages are going up to the cloud, and that's where that gets analyzed, and then it gets sent out to other people. It doesn't get sent to the thriver themselves, right? They just have a sort of screen that they can see on-offs. It's all summarized for them. So that's really what happens in that instance. Now, some organizations, especially assisted living or senior communities, they can choose to let us integrate with a pendant company, so that we can alert them to the fall. And we're also talking to pendant companies, because they get something like 200 false alerts every day. And for those false alerts, sometimes they have to send an ambulance, which is costly and unnecessary. So literally having that telemedicine ability to get in touch with the individual, or to look at the other parameters, the check-in, the engagement on the app, and the activity in the home, can inform them to make a better decision.
Thank you.
Oh, thank you, Shain. One last question, please. Sorry, Shain.
I'm just conscious of time.
Okay. So what is the cost of using the app?
So for the organization, it's £35 for a patient plus 9 people in their circle of care. So it's actually £3.50 per month. Now, with a volume organization, that pricing goes down. And it's a negotiation, yeah.
Brilliant. Lovely. Janet, have you got a question you want to ask?
Yes, very quickly. I do appreciate, the system sounds really great. And I'm looking at your business model. How are you intending to actually ensure that the app is going to be commercially viable and sustainable, given that if it is actually being implemented in different organizations, and then suddenly it disappears in the market, what happens to those patients that's on board?
So Janet, like my background is healthcare, right? So I've had a 10-year career as a physical therapist, right? Graduated St. Thomas's. I was around at GP fund holding and won 12 GP fund holding contracts. I then went out in 2003 to Afghanistan, built the largest telecoms company there, built telemedicine in 2006 and 7, brought Vodafone and M-Pesa, etc. It's all on the net. So I think that the guarantee here, as much as can be, is the fact that I have invested a lot of my own money and the team's money in this application, and we've raised money. And our aim is to basically now, as we begin our sales, to go out and raise money so that we can grow this into a global application, right? Because this is not a unique UK problem. It's a Canada problem, it's a US problem, and 8 out of 10 older adults are going to be coming out of the Middle East and Africa in the next 10 years. So this is a huge market. Obviously, I can't guarantee that the app will continue forever. I can't guarantee that, but what I'm saying is that I think that there are enough good people behind this application to actually get it over the finish line.
Thank you. Can I do just one follow-up, quick one? What have you, in terms of testing, what's the feedback?
So the older people love it, and that's been kind of the stereotypical view, right? That, oh, show me the older people can use it, right? So the older people love it. Friends and family enjoy it because basically, if you're sitting on the train, you see a nice flower or tree and you take a picture and you share it with mum. That's terrific because mum knows that you're thinking about her, not necessarily about the tree, right? So it takes that guilt and pressure off you, right? When we did the testing, we also had caregivers say, well, can we track our own health and wellness? And so we've incorporated that within the app, but we do not share that with the organization at the moment because we don't feel that that's appropriate. Yeah, and so, sorry, I kind of lost track because I got so carried away with what I was telling you, but what was your original question?
It's basically the result of your testing, like any pilot implementation you've done.
Yeah, so the pilot results I went through, right? Older adults could use it, family felt peace of mind, and, were able to maintain their work systems. And the caregivers actually, instead of having 12 calls to field, they could actually converse with everyone in one text. And we also have a care plan in there and a daily update, which once they've filled it in, they can update it and it goes back to the back end. We can integrate with an API into existing systems. We just need the customer to request it because, as you can imagine, we are still small. So we don't have the ability to kind of wrangle people's arms to say, please let us integrate. I appreciate all your questions. Thank you.
Brilliant. Thank you so much to all of you for your fabulous presentations and of course to our fantastic dragons as well. I certainly hope that the people pitching found that useful to go through that process too. So for me, technology is moving at such an absolute massively fast rate at the moment, isn't it? And we have to embrace technology no matter what. We have to go through this process and embrace it, but there will be challenges along the way. And I think it's almost like as we're moving forward, we can't actually catch ourselves up because it's moving so quick. So it's something that we do need to be mindful of. But certainly from my point of view, certainly I've been in the caring for parents, and I know that apps like that can absolutely massively help in terms of blood pressure and making sure that you're tracking that, heart health, but also having that link in with carers and the wider primary and social care providers as well. So that's absolutely massive. And of course, Hapstar, I know that you provide a great service because we use it as far as the IHSCM are concerned. So what I think happening now is that you get the opportunity to vote for your favourite pitch.
Well, we have got an overall winner without that additional vote, and it is Thriving.ai.
Super.
Well done, Shain. I'm going to bring you in.
Thank you very much. Thank you.
So would you like to announce what Shain has won from today's participation?
Yes, it's a year's membership with the IHSCM for 5 people. So that will be on their way. And you will also be featured on our website as well, won't they?
Thank you very much. I think the bar was set very high. I thought both the other presenters were excellent as well. And, I'm really grateful. Thank you for your questions. Makes me better, makes me think a bit harder about all the things that we're doing. Thank you very much.
You're very welcome, and many congratulations to all of our participants and to the dragons. We wouldn't be able to run these events without the dragon participation, so thank you all for that. Has anybody got any further questions that they would just like to ask of anybody, just in case? Just come on. Janet?
I just wanted to ask everyone, because I think we say digital poverty is a real issue. So given that all of these are actually net-based, internet-based, and it's cloud-based, do we have in place a training support to provide support for those that actually need them in terms of whether under, basic upscaling their internet skills or computer skills and all that, to be able to use the application properly, because it's not only actually older people, even younger people, and also even staff in the NHS actually are not very tech savvy, as we say. So it's a question for everyone.
And I would like to come in there, because I absolutely do agree that some people just don't get technology. I mean, my dad was 91 and he really couldn't use technology. We tried to teach him, we really did try to teach him. But I think sometimes, people, there is resistance also. And if there is resistance, then it's very unlikely that they are going to want to embrace that type of technology. And there are people like that who don't trust it as well. So trusting technology is a big issue. So it's how do we make technology as inclusive as possible? Because I think that's so important, because it's great for those people who are really comfortable with it, embrace it, but we need to make it inclusive. We need to bring people along with us, because we don't want them to be left behind because of the benefits that technology can potentially bring to all of us. So I don't know if anybody's got any thoughts. Karen, did you want to say something then?
Yeah, I have. I'm sorry, I keep getting internet disruption, so I've taken my camera off. It's linked to what you were saying. I think most of these applications have got wider use than the focus that has been largely on aging, and there are a lot of people who are socially isolated or have health in or unhealthy, who wheelchair bound or whatever it is, that might benefit from some of these links to other people. And I just wondered how, and it's not for, it's for all these technology solutions that are abounding out there. It's how we ensure inclusivity, but tackling the social determinants of health problems are most evident. So, and I know I don't expect you to answer it now, but it's always something that goes through my mind. What does this do for equality and diversity of users?
Yeah. Karen, I'll just jump in on that. One of the things that we have on the app is something called the shop, but it's not a shop. It's actually where we're going to work on the social determinants of health. But it's just a question of sort of money and cash to get there. But you're so right. It's great telling people eat more spinach, but if those people cannot access good spinach at an affordable price, it's pointless. So, exercise, mental exercise, socialization, and nutrition are all on our pathway, but baby steps right now. And I think that the only other thing that I'd like to say is that we are playing with voice. But Mervyn, just like AI, voice of older adults has issues. And so, when you say, what's for dinner, the bot doesn't understand that you mean for dinner and not for the number 4. So these are things that we're troubleshooting, and I think it will probably be a few years before it's absolutely ready for deployment properly, because older adults get confused a lot easier. And to Karen's point, maybe the demographic needs to move to the 55 plus so that we grow with that demographic. I don't know, it's food for thought.
And equally, conditions such as dementia, how do you train technology to listen to people with dementia and recognise that they perhaps are not asking the right questions sometimes. You know, how do they recognise that? And that's a real challenge, isn't it? Because we're nowhere near that at the moment.
No, it's really interesting. There's a gentleman at this conference that worked for Hasbro, and they've actually created a pet that can listen to dementia and respond. So
Right.
I don't know.
Wow.
Who knows?
Love that. Okay. Final thoughts. Mervyn, I've just got.
Yeah, I mean, it's triggered by Janet, in fact, triggered by everybody. Everyone makes assumptions and have presumptions about aging and old age and older people. And often those assumptions and presumptions actually are with older adults themselves, with carers and institutions and agencies. And there does come a point where hopefully the technology, whatever we're using, AI, whatever, that we never take out. I think again the comment was made about the human element, and that at the end of the day we can often produce responses that are actually oppressive because we have failed to address the assumptions and presumptions we have about aging and old age.
And I think that's a really good point, and certainly something I've witnessed whilst I'm listening to people talking who are talking to elderly people. And even that there isn't best practice as far as that is concerned, you know, how they actually speak to people from an equal perspective, an equal tone of voice, that's not there. So how do we teach technology to speak people with best practice in mind rather than what actually goes on in quite a lot of cases? So yeah, there's some challenges.
There are definitely. That's why we have Thrivers.
Yes, absolutely. And I absolutely love the term Thrivers. I think that's a brilliant term. So well done for that. Okay, so if there are no more questions, we will give you 6 minutes of your day back. But it's been an absolute privilege and a pleasure to listen to you all today. So yes, big round of applause for everybody who's taken part. And thank you so much, and hopefully see you all again soon.
Thank you all so much, everybody. Thanks to our dragons, thanks to our suppliers, thanks to Sue for hosting. Until next time, thank you. Enjoy the rest of your day. Bye.
Bye.
Bye.